Our next speaker hardly needs introduction. Dr. Samoto has really been leading the way with non extraction complex treatments with Invisalign globally for many years. Dr. Samoto completed his dental degree and PhD in orthodontics from Nihon University. He also has extensive experience in periodontology during his tenure at the university. In 2006, he established his own practice in Tokyo and his second clinic in Osaka a year later. Dr. Samoto is a Japan Orthodontic Society certified orthodontist since 2006 and became an Invisalign provider in 2006. In 2012, Dr. Samoto took first place in the Invisalign International Gallery Peer Review Award. In 2013, Dr. Samoto took first and second place in the International Invisalign Gallery Peer Review Award. But that wasn't good enough for him, so in 2014, he took first, second and third place. He is currently a visiting instructor in the Department of Orthodontics at Showa University. He has treated approximately 2,000 Invisalign patients and been a speaker at the APAC, European and US summits. Please welcome Dr. Samoto to the stage.
Hello everyone. 早上好. First of all, I would like to thank Light Technology for giving me this opportunity. And it's an honor for me to be here once again today. This is my, sorry, please, previous. Okay. And I'd like to, today I'd like to talk about elastic jump technique. Elastic jump is one of the methods for maxillary molar digitalization. I'd like to explain how to effectively use this method. And this is my introduction. And I want to show cases, so I will brief with my bio. But if you want to know more about me, please read this paper. In 2014, I and Dr. Vicky Braskalik published a paper about extraction treatment by Invisalign. Today, my focus is not about extraction treatment. Professor Lai already showed us the wonderful cases. I'd like to talk about non-extraction treatment. And needless to say, maxillary molar digitalization is one of the innovative features of Invisalign system. It is well known that we can correct plus molarization by Invisalign. And before talking about elastic jump technique, I'd like to introduce my case using default movement, also called sequential movement. Needless to say, the effect of molar digitalization by Invisalign is obvious. Like this case, we can improve full step plus molarization with non-extraction by Invisalign. And two movies of this slide are clinical simulation of the same patient. Upper figure shows the sequential movement. Lower figure shows that the upper teeth are moving simultaneously using elastic jump. Please look at the simultaneous movement of the entire dentition by elastic jump. And you can see the difference of the staging between the sequential movement and elastic jump. The number of stages in sequential movement for the upper teeth is 78. In elastic jump, the number of stages for the upper teeth is 46. I think almost all dentists have these questions. Please read the following questions. After my presentation, I hope you will discuss these questions with other dentists. And which among these are the effect of elastic jump? Growth, mandibular shift, bone remodeling, teeth movement. I think that most orthodontists believe the effect is caused by promoting growth. Hence, this technique has not been used in adult patients. Is it right? Is there any possibility of other factors? Now, let's start discussing this topic. This slide shows good at the points of elastic jump. Please read the following. In good points, especially for us, ClinCheck design is very simple. It is easy to make simulation. In bad points, if the patient couldn't use the elastics, we can't treat it. Let's see the first case of elastic jump. A 23-year-old woman presented with open bite and protrusive profile. You can see class 2 molar relationship on both sides with excessive overjet. Occlusal view. Cephalometric analysis showed proclination of upper and lower anterior teeth. Diagnosis is two-step class 2 molar relationship on both sides. I planned an upper wisdom teeth extraction and molar distalization. I performed elastic jump. Although the jump occurs at the end of ClinCheck treatment plan, clinically, the jump occurs gradually. This is the staging of the patient. The total number of aligner is 25. You can confirm that all maxillary teeth moved simultaneously. This is the image of pre and post treatment. The aligners are being changed every 2 weeks. The posterior relationship was improved according to the ClinCheck treatment plan. After 6 months, class 2 elastic started from stage number 12. But lower right second premolar was intruded and rotated. So I cut the aligner and used elastic for improvement. Frontal view of pre and post treatment. Excessive overjet has been improved. Occlusal view. The lateral expansion was achieved. Upper incisor inclination has been improved. Lateral views of pre and post treatment. The posterior relationship was improved to class 1. And bite on posterior segment was established. Panel. And please look at the upper and lower first molar distal surface. You can see the class 2 relationship has changed to class 1. And interincisor angle was improved after treatment. Upper molar was distalized to 3.4 millimeter. There was only a slight change in the position of the mandibular bone before and after treatment from McNamara analysis. This is a superimposition of the profile itself. Upper molar discretization was observed, but also lower molar visualization was observed. From X-ray photo, we can confirm upper molar discretization on right side. We can also confirm upper molar discretization on left side. The change of maxillary molar position is about 3.4 millimeter. Cluster elastics were used for 10 months. According to the calculations, it is moving for about 0.34 millimeter every month. You can see there has no significant changes in the TMJ relationship on right side. The profile has been improved after treatment. Smile photos. The smile has been improved significantly. The aligners are being changed every 2 weeks, and treatment period is 17 months. She went to my clinic for 13 times. This is a photo of the retention after 2 years. Occlusion has been kept. If this improvement had been caused by bone remodeling and mandibular shift, I suppose that the occlusion wouldn't be same as this. In Invisalign, full cluster divide is most challenging case to treat. Let me ask you, which would you choose among these three approaches? Two from above are the treatment plan of tooth extraction. I would like to emphasize that the two plans above should not be selected from my failure experience. At first, it is necessary to understand why the deep bite with extraction case is very challenging. The first reason is decrease of anchorage. It easily induces bowing effect. The second reason is that one of the most difficult movements with Invisalign is required. Third reason is the interference of anterior teeth. I named this side effect phenomenon as anterior lock. Next, I would like to talk about anterior lock along with my failed case. And this is a full step class 2 deep bite in the case of upper premolar extraction. On the CleanCheck software, anterior segment hit each other and pass through upon retraction. As you all know, this doesn't happen clinically. This mysterious movement was named Ninja by Dr. Vicky. Even though molars are not supposed to be measurized in the treatment plan, they are actually largely measurized. Anterior deep bite did not improve. The canine relationship was still class 2 after the end of initial program. Additional aligners are necessary for this patient to perform upper discretization. From this case, you can see that the posteriors are moved to the major unexpectedly due to the interference on anteriors. Anterior lock means the situation when interference occurs anterior segment during retraction. Hence, anterior movement is locked. As a result, posteriors are tipped to the major. In order to prevent these errors, anterior movement needs to be done carefully. How? As a solution, first you should choose non-extraction treatment plan for keeping anchorage. Second, upper movement should be done, avoiding anterior interference. For performing these steps, I think elastic jump technique should be selected. Next, I would like to show you a case using this solution. This is an image of a 34-year-old female. Her chief complaint was deep bite. Molar relationship is full step class 2. Left second premolars are scissors bite. Occlusal view. The holometric analysis showed break facial type with 23.6 degree FMA. Inter-incisor angle was larger than mean. Panel shows left and right molar relationship to be class 2 relationship. Diagnosis is angle through class 2 division 2. I planned the treatment for maxillary deceleration and upper and lower incisor intrusion. The upper teeth move simultaneously with deceleration planned using elastic jump. It is important to check that there is no interference when retracting the anterior teeth in ClinCheck. These are the background views of pre and post treatment images. Staging. The total number of maxillary aligner is 38. After 10 months, stage is number 20. The aligners are being changed every 2 weeks. I started class 2 elastic from stage number 14. After 11 months, I set the bottom and elastic on upper left 5 and lower left 5 to improve the scissors bite. After 13 months, molar relation on the right side is still class 2. After 23 months, this photo is the end of initial treatment. And the photo above an image of the end of initial program. The photo below the actual results of the end of initial program. Molar relation on both sides is still half unit class 2. Class 1 molar relation could not be achieved, so I conducted additional aligners. I performed elastic jump again to be class 1. The total number of additional aligners is 25 in upper part and 15 in lower part. And for additional program, the aligner is being changed every 10 days. This slide is showing the result after 26 months during additional program. Plus the elastic studied from stage number 1. After 32 months, this is the end of second program. Occlusal views of pre and post treatment. The lateral expansion was achieved. Clouding has been improved. Severe deep bite was improved. And backal views of pre and post treatment on right side. The posterior relationship was improved. The intrusion and lingual root torque of maxillary incisor were achieved. Same result was achieved on the left side. The panel also shows the improvement of the anterior deep bite. Molar relationship has improved to be class 1 from X-ray photos. Upper molar was decided to 2.7 millimeter. According to the calculations, it will move by 0.12 millimeter every month. Very little. You can see there is no significant changes in the TMJ relationship. Interincisor angle and FMIA were largely changed. The anteriors have intruded and the deep bite was improved. Upper molar was decided 2.7 millimeter. There was only a slight change in the position of the mandibular bone before and after treatment from McNamara analysis. It may be within the range of measurement error. This is a superimposed position of the profile and sect. Upper and lower anterior teeth were intruded. Upper molar distalization was observed. In initial program, aligners are being changed every 2 weeks. In additional program, aligners also being changed every 10 days. The treatment period is 33 months. She went to my clinic for 21 times. And let's see the other elastic jump cases. I treated various class 2 cases by elastic jump. Average treatment period of elastic jump is about 23 months. In clinical, all cases are adult patients. And most of cases today are class 2, half unit class 2 case. In clinical practice, I try to avoid elastic jump technique in full class 2 case. The reason is that elastic jump hardly work in full step class 2 due to the interference of cusps. I sometimes struggle to achieve molar distalization. So I recommend using elastic jump only in the case of the half-step class 2 case, except deep bite case. And, to summarize today, can you please read the following? Please take a photo because I have no time to explain. And the most important thing is the last sentence. We need patience when using elastic jump because the movement speed is very slow. Finally, my image of the effect of elastic jump is this slide. My conclusion is that this movement is the most important factor of elastic jump. Last slide shows the important people for Invisalign treatment. The person at the far left is Professor Maki of Showa University, who introduced Invisalign in Japan. I am still learning a lot of things from him. Together with him, I established Japan Aligner Medical Society last year. Please attend our meeting in the future. The people next to Professor Maki are Vicky Braskalik and Professor Boyd. No need to mention about their achievement, but they have a worldwide contribution in Invisalign treatment. I'm deeply grateful to them. And right photo shows my cheer team at Tokyo Disneyland. I'd be honored if my presentation will help your orthodontic treatment. Thank you for your kind attention.
Thank you, Dr. Samoto, for another enlightening speech. To finish up the